So I understand that your association then provided you with the opportunity to do a pilot study. Yeah, we're very interested in hearing about that. So tell us what you did, how you did it, and what you discovered. This is wonderful.
Okay, I had 80 persons. They should drink 1.5 liter artesian spring water every day, and besides that, they should not change anything in their life. And I had 30 patients with the diagnosis depressive episodes or anxiety disorders from my psychotherapeutic office, and 50 others as a control group. And they are mentally healthy persons. And but I saw that all these persons had further physical complaints. So, for example, the mentally healthy ones had also migraine or tinnitus or sleep disorders, pains. I had some people with high blood pressure, with diabetes mellitus. I had some people with cancer in the history. And so I had the opportunity to watch a lot of symptoms, what happens if they drink 1.5 liter artesian spring water. And they should make the observation, then they write it down. And all patients and all participants got a detailed questionnaire about their lifestyle, their mental and their physical health. And for all persons, I took the free radicals and the antioxidant capacity. And this, so I got a lot of detailed
strong data points. Yes.
Yeah. Yes. And this was the setting. They should not change anything. They should watch what happens and give feedback after 4 weeks, 8 weeks, and 12 weeks.
And then what with 80, that's a pretty big cohort. 80 people is, substantial. And then across the range of, so many of our pilot studies they take disease-specific people and package them, and that's the study. So what you've done is unique, which is cross multiple. Again, you're doing such interdisciplinary work, even with the patients that you selected. I'm very interested to hear what you discovered from this.
The interesting thing with the blood values were the antioxidative capacity. I took that for each person 4 times, and it shows that the antioxidant capacity increases in both groups. And so you can say the oxidative stress is reduced. Because the antioxidant capacity has the ability to buffer the free radicals. And in medicine, we know free radicals, if they are not in the balance, if they are always too high, so they harm the body, and they are associated with chronic diseases, so chronic inflammation, with cancer, with Alzheimer's disease. And so with this increase in the antioxidant capacity, you can say that only by drinking water, this artesian special water, you can help to prevent chronic diseases. That was the first thing that really impressed me.
Yes, we think that's impressive too. And to talk about water as a buffer against free radicals, would you even support the idea that something like EMF, that water could be a buffer against the electromagnetic frequencies that we're also receiving through cell phone use and cell towers?
I'm quite sure that it is so, but it's not investigated. But I'm quite sure there is really a chance to
Yes.
investigate it,
Yes.
and I think
We're
the
trying to get those studies done too. Maybe we can
yeah,
link up our resources
yeah,
and make
yes,
sure that, but I agree with you because it's such an upstream intervention.
yes,
Whether the assault on the body is chemical or as in pesticides, or it's biological as in viruses or bacteria, or whether it's electromagnetic,
yeah,
what happens in the body with those insults is the same process. So having water, knowing water's ability to buffer that is really, really important. Most people do not think of hydration as the way to help us cope with these electromagnetic assaults or chemical assaults, or we have one answer for all
yeah.
of our environmental.
Yeah, I think it's right. And some researchers now believe that every disease starts by the disrupting of the structure of water in the cells, around the DNA, around the proteins, and that's the start of the beginning of chronic diseases, and they call it external water stress, external interfacial water stress.
I've never heard that term before. I like that.
Yeah, that's really good, because if you imagine this EC water is along all the surfaces, the interfaces in the cells, and if you disrupt the surfaces, if this structure on the surface, this jail water, how you call it, or this EC water, then the proteins don't work right. They are damaged, and so that's the basis of development of several diseases.
How did you, Dr. Deutschlander, how did you discover Dr. Pollack's work and the easy water? Where did the structured water concept enter into your life and your training? How did all this come about?
It enters in my life after I saw the results of my study, because I couldn't believe it. I couldn't believe the results of my study, and I thought I have to investigate. I have to find an explanation what happens. Why do all these things go in the right direction, in the direction of healing, with many complaints? And so I started to read every book I could read about water research I found. And then I was really impressed from this book from Jared Pollack, and I understood how the healing power of water works with his explanation.
Fascinating. Tell us I don't want to derail you from telling us the results of your study.
Yeah.
So we've swirled around a little bit, but give us the specifics, and then we can talk about Dr. Pollack's work.
Okay. The next thing was the physical complaints really go down. I could observe that in the patients with pain and in the patients with diabetes mellitus, in the patients with arterial hypertension, they had to reduce their medical dose. So the insulin dose, they had to adjust it. And that impressed me really, because I never expected it. So the people told me that they lose weight, and for me that was one explanation. They lose weight because they didn't want to drink alcohol any longer. They didn't want to drink soft drinks any longer. They didn't want to eat fast food any longer. They had more appetite for fresh, and so their behavior and their nutritional behavior changed in the direction of more health conscious.